Hello and welcome everybody. This is Ananya Biswas from Indian Society of Calgary. We are presenting here today a very, very important discussion with some esteemed panelists who have joined us this evening for a conversation about the ongoing global pandemic, the COVID-19 novel coronavirus. We have some prominent people from our community offering their insights and having a discussion about medical advices, community behaviors, as well as their own journeys having gone through or experienced this disease. So I will go ahead and introduce them, but do join in. If you haven't liked or subscribed our channel, please do so. We will be showcasing this on our new platform, the ISC Entertainment Network. So please be sure to join our Facebook page for regular updates. So thank you very much, our panel of guests. Warm welcome to you for our discussion here this afternoon. Really appreciate it. First off, I'd like to introduce Mr. Jay Chaudhary. Thank you so much for joining us. Why don't you please go ahead and tell our guests a little bit about yourself?
Namaskar, Anina. And also a very good afternoon to Rishi Ji from CKYR 106.7 Red FM, and also Dr. Kippur, who is with her, a very distinctive doctor here in our city, as well as Devesh Oberoi from ISC and Anonna from ISC too. It's a great privilege for me, I believe, this afternoon to be with you. And we will continue our talking journey from here. That's in a nutshell. Where I work as a banker as a daytime job. My background is I am an economist. I completed my graduation in economy, but also I have completed an area of specialization on, and I used to work for the UN for the children in difficult circumstances, exclusively on sexually exploited children. So I've done that for 16 years as a director for Asia Pacific for the UN Pacific Office, based in Bangkok for 9 years. We came to Canada. This is my 16th year, and continuing our journey as a RJ with Red FM.
Thank you so much for sharing that with us, Jay Dada. Thank you, and very warm welcome to you on our show. Next, I will move on to Dr. Anmol Kippur. As JG mentioned, he is a prominent and a distinguished doctor within our community, within the entire Calgary community. Dr. Kippur, welcome. Thank you so much for joining us. Please take a moment to introduce yourself for our members here on this group.
No, thank you so much. I'm not as prominent as we have with the panelists. I'm a physician working in Calgary and do try to help save lives as many as I can. That's the only thing I could explain myself into those two lines. Thank you.
Thank you so much, Dr. Kippur. Moving on, we have Mr. Rishi Nagar. Thank you so much once again. I know you are a very familiar face within our South Asian Calgary community. Welcome on our show. Thank you so much for joining us.
Thank you, Ananya, and thank you, Devesh ji, and for giving me this time, this opportunity to be with all of you. And I'm the news director and host with Red FM 106.7. I'm also a member of the Senate at University of Calgary, and I'm also the member of the brand new anti-racist action committee established by the city of Calgary. And that's it. I think it's a lot for me. Thank you very much.
Really appreciate all your efforts, Rishiji, and taking on so many very important initiatives for our city. Welcome once again. Another very important member that we have with us today is Poonam Kumari. Thank you so much for joining us, Poonam. She is a resident of Northeast Calgary. I'll give her the opportunity to introduce herself to the members of our Indian Society of Calgary group.
Hi, everybody. Thank you for inviting me to this meeting. And I am a resident in Skyview Ranch, Northeast Calgary. And I am also working in Amazon as a warehouse associate. And yeah, I'm seeing quite a lot of COVID-19 cases. I'm a little worried about it, but can't help it. So yeah, and I'm here in Calgary since last 3 years.
Fantastic.
Yeah.
Well, thank you so much for joining us. I think that'll be an interesting we'll be really interested to listen to your side of the story, especially when it comes to a lot of us working class individuals who have to kind of go into work and see what's happening in that community. So let's start off. I think we'll start off this conversation by sharing the story of Mr. Jay Chaudhary. I guess you know how the theory goes of survival of the fittest. He is a prime example of that, having contracted this disease, having gone through it, having been on life support for several days, and now in his post-recovery stage. So Jay Dada, please, I'll give you the opportunity to please share with our members your journey so far, your story, and your insights about this entire experience.
Thank you, Ananda. I know where it all started, but sometimes I try to recall where did it end. I still don't recall how did it end, but I know how did it started. 8th of March, a very bold letter day for me, in a place in Coral Spring in Calgary, Northeast. We gathered in a group prayer meeting from our church. And we were there in the house together, 32 of us, and 28 of us got contracted with COVID. 4 of us got spared, and all those 4 were kids. So somehow they didn't got contracted right away. 8th of March, all the way till 17th of March, our life was very normal. When I say our life, all of us, all 28 of us. No coughing, no fever, no symptoms, no shortness of breath. You know, all those check marks, everything is no, 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 no. The border was open, the airport was open, the school was open, everything was open. So we really didn't know what it was. Until I had this fun day, and this was like, I think 4 or 5 days after. My wife is in the healthcare industry, and she was told that to continue her job, they all have to bring the certificate showing that they're COVID negative to continue their job. Otherwise, they have to sit back until the certificate comes. So I still remember I drove her to the Calgary Children's Hospital, one of the former Children's Hospital in Calgary Southwest. So it was a drive-through. We never had this experience. I was feeling good, you know, like, wow, you know, it's like drive-through McDonald's. And the nurse came on the right-hand side and took the test of my wife, and they asked me whether I am interested. And I just out of curiosity, I am always curious, right? So I thought, why not? It doesn't cost me any money, so why don't I do this? So they did my test. I had to fill up some form, took only 10 minutes, and then boom, we are out. Those days, we cannot get the test results like now you get. And I suddenly get a phone call after, I will say, about 8 days. And all these 8 days, I was going to work, we were going groceries, we were doing shopping and everything. But this phone call comes and my phone rings and I see family doctor. And I was very shocked because this family doctor is with me for past 12 years. And never, ever, ever, he actually called me. So he calls and he says that, I'm very sorry to let you know that your test has come positive. And what I want you to do, because it's already 5 o'clock, I want you to go to immediately to Peter Lloyd Hospital and take to check your oxygen level. I don't know why he said that. I really didn't took it serious. Initially, I thought maybe, you know, I don't know what is the oxygen level and all. I have no problem, you know. So let me just sit back, relax, maybe go tomorrow. But my wife said, no, if the doctor have called you after 12 years, something serious. If he have never called you, but calling you after 12 years, you should go to Peter Lloyd. Let me take you there. So I didn't want it to. I was feeling a little dizzy, but I didn't want it to go to the hospital because I have never in 50 years have been actually to hospital or ever admitted to a hospital, which is a blessing, I think. And I just walked in to the ER, and nobody was allowed to go. There was a big sign, no visitors, nobody can accompany. And I just, you know, sanitized my hand, and they said, just go right and sit in that room. There was no one to take admission. You know, generally you go and tell your name, you show your card. Nobody was there. So we were taken into a room, and I was sitting there with other visitors, and there were 4 of them, and they're not patients. They were visitors, came to visit someone, and they were sitting with me. And the nurse came and they brought something and put my finger there and took an oxygen, and her face started looking green. And I was very shocked that why she's looking like that. And she said, let me come back. And she ran somewhere and she came back in 5 minutes. And she said, we have to take you immediately. We have to take you in. And I felt like, like what is going on? Why they have to take me in? I'm smiling, laughing, nothing, no problem and everything. I just feel a little bit of feverish. That's all, but not coughing at all. And the oxygen at that point, I was told, was 72. And they immediately brought a bed, and I went, I just lay down in the bed. And in our culture, we don't go to the bed with shoes. I still remember I opened my shoe, I kept it under the bed, and I just laid down. And they started moving, immediately, like the movie, like one of those Bollywood movie. So they were moving as they were moving the bed. And I saw everything double vision. I saw like exit 2 times. And there was a police, I remember, standing on the corner at the reception or something. And I saw 2 faces of the police. And I got a little scared. Why am I having double vision? And immediately it was as I'm going to sleep, and I just faded out. And that's it. And I was told, I woke up after 25 days. I was in induced coma. That was a history. The nurse looked at me, and you've heard this before, many of you. The nurse looked at me. I saw there were pipes running on my right-hand side, right hand. There were 4 holes on my here, neck, on the throat side, on the right side. And then I had a catheterizing pipe running out. Looked at her and I said, 24 hours, what's going on? I really want to know, because it took a while actually I was confused. It took a while for me to know where I am and what is going on. So I smiled at her, and in Canada, a lot of doctors and nurses, they wanted to cheer you up. So they crack jokes. And I know that, And I thought she's joking with me. She said, not 24 hours, you're here. This is your 25th day. So you're in coma. You just woke up. We just moved you out to ICU. And I could not believe that. I thought it's a joke. So the doctor came around 11 p.m. I still remember, and I completely forgot. And I asked doctor, I want to ask you something, I had a very joke of the day. And I remember I said, I had a joke of the day. This nurse is telling me something happened to me and I was sleeping for 25 days. और मैंने ये कहा कि हमारे इतिहास में एक गल्प कथा है ना कि कुंभकर्ण सो जाते हैं लोग कुंभकर्ण जैसा, राइट? और हम भी ऐसा कुंभकर्ण कुछ हो गए थे और मैं सो गया था और 25 दिन बाद मैं जाग उठी. ऐसा तो I have never heard like anyone sleeping for 25 days. Even, dead people probably get up and not 25 days. तो डॉक्टर ने मुस्कुराया और मेरे से कहा कि I'm sorry to let you know what she said is very true.
Wow.
I could not believe that. 25 days. Like it takes 25 seconds to count 25, right?
Yeah.
लेकिन मैं जो बात कर रहे थे डॉक्टर साहब के साथ, ये हो गया था कि I could not speak. मैं अभी जो बात कर रहे हैं ना, just to say hello takes 10 seconds. Like nothing was coming out from my throat. Absolutely nothing. Probably the pipe went running through my throat, and doctor will tell you in few moments from now. और मैं चल नहीं पा सकते थे. मेरा totally paralyzed from my left leg. I could not come down to the feet. I was at the mercy of nurse. मैं बेल दबाते थे बाथरूम जाने के लिए, फिर आधे घंटे लग जाते थे हमें पुश करके वो निकाल के in the wheelchair and then take me inside the bathroom. और फिर वहां जाके फिर मेरे को और आधा घंटा बैठना पड़ता था कि जब किसी का मौका मिले, टाइम हो, वो हमें वापस ले आएंगे बेड पे. And they have to, 2 of them actually lift me up and push me to the bed. So it took almost a month after that, being in the hospital. I came home. As of now, it's going good, but I have good days and bad days. कभी-कभी मेरे को ऐसा एहसास होता है कि मैं totally I lose my energy, like just ball drop, no? Totally I can't just move. कुछ चीज हमारे साथ से मतलब कि छीन लेके गए मेरी जिंदगी, जो है कि I cannot jog anymore, I cannot run anymore, and I was told, doctor said 2 years it will take to heal my lungs. A lot of torture has gone through there.
Especially with the ventilator, being on life support and everything.
Right.
Yeah.
For 25 days and 25 nights.
Yeah.
And yeah, I look good, you can see.
Yes,
but
you
there
do.
are moments, I will say not times, but there are moments. I just feel like, like I'm flying with no weight on myself. It's just, I am, floating in air.
Yeah.
I don't know what is that side effect. Other than that, I think I'm very normal. But what I wanted to tell every one of you, you have seen me in many newspaper, in many television. In fact, the premier was quoting me day before yesterday.
Yes.
And a lot of people actually who wrote back there and said that I come from Colombia, from a post-communist country, and I was paid actually by a very fat check from Donald Trump. I was paid by Justin Trudeau. And my job right now full-time is to scare the Canadians And they said, like, scare the SH out of them and to make Canadians defunctional because it's a hoax. And I have been paid to do my job, and I'm a very good drama director, and I'm also an actor. My actor is my act is perfect, 100%.
Right.
And this is all coming as a comments. But the beauty is that, the the negativity that is coming is just, I will say, 0.01 Canadian population. It's not
Yes.
from the majority.
Yes.
I want to say, everyone, don't take this easy. You don't know what is inside you. You only know how beautiful you looks, how handsome you looks. You know how to put a makeup, but the doctors know what goes through inside. I wish we can open our body sometimes and see the torture that we do, but we don't know. It's not a 14-day game. Somebody told me, ये 14 दिन का खेल है, छुट्टी ले लो, मजा उड़ाओ, मस्ती करो, मौज मनाओ. It is not a 14-day मौज मनाओ, मस्ती करो. क्योंकि some people look at it differently. सरकार हमें पैसा देंगे, हम बैठे रहेंगे, हम काम पे नहीं जाएंगे और पाबंदी लगा के हम 14 दिन मस्ती करो. In this 14 days, anything can happen to anyone.
Exactly.
And you are basically playing with life and death. The ball is in your court. What you want to do is completely, it's your freedom to choose. We are not there to tell you. And the last thing I want to say, we are right now no more in an elementary school. We have moved into junior high. We have been told, wash your hand, sanitize your hand, wear a mask. And Dr. Saab will tell you. And he also, in one of my interviews, said, wear a glass. Very important. It is that serious. We have moved out of that elementary school. We know what to do. But now we have moved to a stage that is junior high, where it is very important for us. It's not only to protect ourselves, but important to protect others. Because you don't know. You might be standing next to a widow. You might be standing next to a single mother. You may be standing next to a man who have lost his wife. And he's the only bread and butter earner of that family.
Absolutely.
And I know there was actually a person here in our Calgary who had 2 daughters. And when he was called 911 and taken, same like me, on ventilation. And he said, my daughters were all alone. Nobody, including their relatives, with a little daughter in the house, actually came to feed them. Neither left any food outside the house because they were also scared that kuch na ho jaye aur hamari zindagi barbaad na ho jaye. That's all, Ananya. Back to you.
Thank you so much, Jay Dada. You have really put a lot of real life perspective, and I completely agree. I think Facebook sometimes can become a platform where people just like to people bash, so to say, discredit your experiences and call you names and put you in a negative light. But I think your experience is something that I know you at somewhat of a personal level, so I know that you are in fact not a drama teacher. You are in fact not acting, and you are in fact not paid by these so-called organizations or individuals. And I think, to your point, I do want to tell our guests, before we move on to our next panelist, that one of the things that has come about of COVID-19 is that it is not a one-size-fits-all. It's a virus that affects everybody very differently. So obviously there is a very high rate of recoveries, but you never know I've read reports, I've heard stories of young athletes in the prime of their careers completely damaged because of this virus, whether physically, whether mentally, whether in their general capabilities. Like you said, you have night and days where some days are good, some days are incredibly difficult, and your life has permanently transformed, right? But that is coming from a layman host, so to say. So guess I will actually take the attention to a medical expert who would be able to shed some more light on this. Dr. Anmol Kapoor, thank you so much for joining us. What would you, we'd love to hear from you about this novel coronavirus, disease that has kind of overpowered everybody here. And what does your expertise have to say?
Well, I'm humbled to hear what Jay Bhai went through it, and it's in the way you described. It's a very smart virus. And that's what making people more confused, and that's why they're calling it a hoax, because they're not understanding how this virus is working. Because every second person who we call a positive case, like Jay Bhai mentioned, they have no symptoms. And people say you are scared and 14 days you are having fun, and come on, I was positive, nothing happened. And they essentially, when I say when they have nothing happen, meaning that the virus use them as a carrier. So virus was so smart enough to just use their body, then try to find other victims. So someone is using your shoulder to shoot a bullet. And so you are getting used by a virus, and you're correctly right that you don't have any symptoms, and you may feel like a fun, but now you are part of the whole game because this virus is going to kill someone, and your shoulder was used or your mouth was used. That's why wearing mask is quite common and important for us to prevent this virus getting out of our mouth, because it's like a gun, it's like a bullet. It's going out, and we don't know how many bullets will a person need to be able to sustain, to stay alive or not alive. So it's very, very important. So that's why, and I sympathize people who have no symptoms and they do believe that it's a hoax because they don't feel anything and they see livelihood getting destroyed, their jobs being destroyed, the homes are under bankruptcies, and the real fear is there. And I acknowledge their fear, where they're coming from, but at the same time, making sure they realize that it's a serious thing. Had this virus becomes like a SARS virus, or had this virus become H1N1, then we knew that guaranteed someone would have symptoms. In this case, this is a challenge because this virus goes under cover. We have no idea, and attacks someone we have no idea, and impacts severely in some people, doesn't impact much other places. And now they're coming down to question of survivability. Everyone is throwing the numbers out: 93% survivability, 98% survivability. But when you look at patients like Jay Bhai, uh, yes, they are alive, they're able to talk to you, but they're not the same people what they were before. Their lungs are damaged, their life expectancy is lower. I'm praying for Jay Bhai to be live longer than me or other people. But what I have seen in what this virus has done damage, kidneys have been damaged, people have developed lung fibrosis, people have developed heart failure. We are expecting a tsunami of patients. Even the COVID pandemic is done. For next decade, we are expected to be spending at least double, if not the triple amount on healthcare because of the chronic damage it will leave behind. It's like a big hurricane that is going to now going through our cities and country and our families. But the devastation it'll leave behind will resonate at least for 10 to 20 years. So we have to be aware of that, this virus. We have to take it seriously. So now the question comes down to is what else we can do and what is out there in medical field. So 2020 was a year we didn't know much about virus, and we didn't know which medications work, which medications did not work. And we came to know that most of the medications, starting from President Donald Trump promoting hydroxychloroquine, to a lot of people believing in antibiotics and some other plasma antibodies and so many other things people tried. We know that so far dexamethasone is the only medication, which is a quite old medication, was able to help us out. Because what virus does, it causes a huge inflammatory reaction in our body. It just essentially shuts our organs down. So when we use these medication, dexamethasone type of medication can help us reducing acute inflammation. But we cannot recover the damage that was left behind in so many other patients. So 2020 year was the year where we're trying to figure it out, what works against this virus, what doesn't work against this virus. 2021 year will be more interesting than what we know. The vaccination story will be out there. People will be getting vaccinations, some may not be getting vaccinations, some vaccinations will be manufactured by various companies, some will be getting promoted, lots of people may have some vested interest, and that will be making our lives more confusing. Some may say X vaccine is better than the Y vaccine, the Y vaccine caused this damage to the other vaccine. There'll be a lot of myth and stories out there, and those stories were there against vaccination for a long time. But we know that vaccinations are able to prevent severe symptoms in many patients in the clinical trial I have seen. But what we don't know is that can a vaccination prevent this infectiousness? If a person believes that getting a vaccination, they are immune, now they're okay, and look, I got a vaccination, I can go around and hug my mom. It may not be true, because I may be, again, the silent carrier at that time, and my mom, who probably has not received vaccination or might not be responding as much strongly to that immunity that vaccination should be triggering in her body, I may be passing off this virus without knowing that. Yes, I'm immune, but she's not. So that is something we don't know yet. We don't have any answers there, but we will know those answers in the coming year. Yeah, we will be continue to wear a mask. This is a fact. Even if you got a vaccination done, mask is not going to go away. Even if you got a vaccination done in the foreseeable future in 2021, we'll be still doing a social distance. So that will be part of the norm, which I can tell you, because vaccination is just going to prevent us getting admitted, like Jay Bhai had to get admitted to ICU. So we are hoping we can prevent hospitalizations, but disease is not going to go away. It'll be with us over the next few years.
Thank you, Dr. Kapoor. That is incredibly important insights from obviously a medical expert. So I do want to, kind of reiterate your message to our community कि ये disease अभी है हमारी community में, ये कहीं जाने वाला नहीं है. It's very much a part of our lives, and it's almost better to accept that and accept the new norms in the way we live our lives. And very rightly, like you said, the virus is so challenging that it's not a standard flu virus, or it's not a standard virus where we have this, spec chart ki ye virus ye hai, this is the problems that it causes, these are the organs that it's going to affect, these are the ways to treat it. Like, I think it's different with everybody. Like we've obviously seen, Jay Dada was in the hospital for 25 days. Some people, like I know a couple colleagues, they contracted it from foreign trips. They came back home, they quarantined for 14 days. They had very minor symptoms, and they were well on their way to work after the 14-day quarantine. So, and they didn't even have to go to the hospital. It was almost like a regular fever for them, runny nose, fever, body ache. Some days were bad, some days were good, but then they eventually recovered. So I think in that sense, the disease has such a broad spectrum that, you really can't pick where you land. And like I think Jay Dada mentioned this, that you're really playing with your life if you choose to ignore any of these safety measures. And like you rightly pointed, I think being the vaccination is not going to be a sure shot way for you to not get the virus. It might just help in mitigating some of major damages. So like you said, maybe it'll help you from avoiding severe hospitalization. It might reduce the effects of the virus, but it's not a guaranteed preventative measure from the disease itself.
And that's going to be the story for 2021. And I do understand people in Indian community when they talk to their friends and family in India, and the common message they're hearing is, oh, COVID is done, nothing happened to us, my friends and family are alive, and it's done. It's Punjab. People are saying COVID is khatam ho gaya. There's no COVID there. It's just because they're not doing testing enough, the disease is spreading. There's a social stigma associated with it. They don't want to call it out. They don't want stickers to get pasted outside their houses in India. So they don't want the testing done. So if someone dies, they just want to let it die. And they don't want to get it tested done at that time, even because people won't be able to pay last rites to the family members. So they're believing more important that than get the COVID test done. But COVID is there. When you look at the proportion of people getting admitted to hospital in Canada, we have more South Asians that are admitted to hospital proportional to the population in Canada versus other communities. So the theory out there people have somehow Indian people are immune. Well, I don't believe that Indian people are immune. Look at UK, look at US, and wherever the data we believe is accurate, we have a proportion of the population, we have more South Asians admitted to hospitals. So we do have a comorbid conditions. We do have more diabetes. We do have more high blood pressure. We have more heart disease. We have more chronic conditions, and we have obesity. Because every second person in South Asian community is obese. Look at the stomach size. And COVID loves obese people. So if you have a big stomach and you want to prevent a COVID not damaging your lungs and kidneys and heart, start losing weight. It's the best way to protect it.
That's a very interesting point you do bring up, Dr. Kapoor, because I think one of the things, like, just as a culture, as a South Asian culture, food is an important aspect of our culture. And generally, it's funny you say this because, like, communities outside of India are making businesses out of our traditional practices of yoga and Ayurveda and healthy eating, but our own people, we are resorting to, more deep fried stuff, more desserts, more kind of lavish indulgence in our food, so to say. And exactly to your point, because we have so many pre-existing genetic conditions, we are more susceptible to falling prey to this particular virus.
It is. And at the same time, I would like to also clarify regarding immunity. A lot of debate people have. Say you got a COVID and today you got a COVID positive, you have no symptoms. If you have no symptoms, it means you don't have a strong immune response. You may get a COVID again, and it may be more damaging, because we have seen some case reports, people got a COVID second, third time, and those episodes are more severe than the first time.
Yes.
It means you are not immune, even if you got a COVID. And Jay Bhai might have a stronger immunity than your friend who probably just had a fever, nothing else, at 14 days.
Exactly.
For the short-term period. So we don't know. So that's why people need to be aware. Hey, I just got COVID and I have immunity. No, that's not the question. We don't know that. And we don't even know the natural immunity is more stronger than the immunity that could be induced by vaccines.
Right.
So we need to be aware. We need to be cognizant. I know it's frustrating. I know it's tiring. I've been frustrating and tired every day. Like yesterday, I got a letter from one of my future patients. I haven't seen that because we mandate everyone coming to my clinic since March, they have to be wearing a mask. Now she is writing human rights, charter of rights, Canadian, blah, blah, blah. She write a big email. If something is going to happen to me and I don't want to wear a mask, then advanced cardiology clinic, Dr. Kippur will be responsible for my death and all those complications just because she doesn't want to wear a mask. I'm not asking anything else. Like everyone else, we're asking all the clinics, wear a mask when you come in. And if you're coming, other thing I'd like to pass on a few things to your followers. One thing is don't wear a simple cloth mask, guys.
Yes,
simple
thank
cloth
you.
mask. A simple cloth mask has no value. It's not protecting you. It's not protecting me. Not protecting any of my family members. If you want to wear it, please get those blue masks. They have a water barrier. If you want to test them, just put a few drops of water in the inside the white layer and see if the water seeps through it. If the water seeps through it, then probably not the right mask for you. So when you're wearing a rumal, when you're wearing tati, when you're wearing something around your face, believing it's going to protect you, no, you are spitting out your virus from your mouth and giving to your family members, okay? Stop doing the same mistakes. This is how disease is spreading. Second
That's
thing
a very good. Sorry, Dr.
Yeah, so second thing I will recommend is to everyone that have a plan. If you are a person who are a risk taker and you want to go out without the mask and talk to friends and family, or you work in a workplace environment where people are not wearing masks and you're getting exposed, try to pick, if you can afford to pick, a separate dedicated washroom just for yourself and a separate dedicated bedroom just for yourself, okay? This way you can at least limit exposure to your friends and family, especially your parents who may be senior. And if you are positive, please stay in your room, in your own house. Ask your friends and family to help deliver food to you. When you're going out within your own household, you're spreading your disease to your friends and family who live with you.
Thank you
Please
so
take
much
it
for
serious.
Thank you so much for sharing that, Dr. Kippur, because I do want to, in addition to your points, I think one of the things that you mentioned here, to have your friends and family deliver food. I think in our community, we have, as it is, a lot of taboo and stigma around several different topics. And like you previously mentioned, this whole COVID situation is also becoming a stigmatized issue more than an actual disease or health related issue. Like you said, people don't want to get tested anymore because they don't want the social dilemma. They don't want to be in a social dilemma that, oh, now I'm going to be blacklisted because I had COVID and nobody wants to be my friend anymore, or nobody's going to be able to do my last rites if I die. My family is going to go through a lot of shame, so to say. So I, through the medium of this particular conversation, and thank you for sharing that, Dr. Kippur, I really want to tell our members of, especially at least the Indian Society of Calgary group, that you're about to die. I think any kind of stigma or shame, everything goes out of the window when you're about to die if you get this virus. So I want to really encourage the followers of this group to think more rationally and logically, and obviously listen to a lot of medical advice that is being said that it's not going away anytime soon. It affects you in several different ways. It's going to cause multi-organ failure. Who cares if, people don't want to be friends with you for a little bit? I think your health and your well-being and your family's health and your family's well-being is utmost important. So thank you so much for sharing that, Dr. Kapoor, and for all the valuable insights that you've given, especially about having the proper mask. This whole pandemic has created a lot of business for a lot of clothing manufacturers to come up with dumb cloth masks, and it's a fashion statement. I've seen so many girls in India wear net masks as a fashion statement, and I'm like, that is literally not serving you anything. Like that's that's useless. Why are you wearing that?
Exactly. And mask wearing is very important, and the right mask wearing is very important.
Absolutely.
Otherwise, you're having a false sense of security, which is worse than not having a mask, in fact.
Absolutely.
So how to wear, how to remove it, you have to know. Don't just keep touching it. I see all the time, patients keep touching in the front. If your hands are dirty, you're touching in the front, you're making dirty, and the virus now going through your mouth, okay?
Mm-hmm.
So if you want to adjust it, adjust from the bottom or adjust from the side. Don't touch in the front if your hands are dirty.
Okay, that's another good point for the members to take note. I think in the essence of time of this discussion, I'm going to quickly move on to Poonam here from the Northeast community. Poonam, we have been hearing reports that obviously there's been a surge of cases in the Northeast quadrant of Calgary, and you being a part of it. We'd love to hear your thoughts on it, because obviously, like I previously mentioned, there is a stigma around it. There's this perception going around that this particular quadrant is troublesome, as well as when political leaders are also kind of implying that. What are your thoughts on that?
I'm not sure why they're calling it troublesome, but the thing is that Northeast Quadrant has most of the frontline workers. It's like we have many of the people who are working in warehouses, then there are people working in Walmarts and different stores, which can't be closed at this point of time. And we also have like people working in hospitals, and they can't stay home just for the fear of COVID. They have to go out and work. So that is one of the things. The second thing, what I feel is that people in Northeast, most of them don't use their own cars, or I'm not sure if they have the driver's license or not, but they mostly use public transit.
Okay.
So using public transit without much precaution is also like one of the reasons why the cases are spreading up so much here.
Mm-hmm.
And another thing, I don't see people fall like they don't have it in their habit of wearing a mask, maintaining social distance, or sanitizing their hands or washing their hands often. So it's still not in the habit of the people.
Mm-hmm.
It's like if it has been mandated by stores and warehouses, then they do it only if it's mandatory. But
Right.
it's not like on their own free will. So
Mm-hmm.
this is something like people don't follow very freely. They feel that it's okay, like I'll just scarf for a few days, I'll stay home, and then I'll be fine. But then it's like I'm not sure if they think about the future or if they think about other people or not. But then yeah, this is definitely I don't see in people's habit here. Yeah.
Thank you for sharing that. I think that's really interesting perspective, because obviously targeting of a particular community is not right by anybody. But at the same time, I think you gave two very important reasons, which could be one of the few main reasons why the cases are rising is because, number one, a lot of frontline workers live in that quadrant compared to some of the other quadrants in the city. And number two is, if a majority of them are using public transportation, then obviously that safety bubble, it no longer exists, right? You are exposed to a lot more people, you are exposed to a lot more environmental elements for you to get that disease. That's really interesting to hear, Poonam. And you being one of the warehouse workers associates yourself at Amazon, what are you like? I'm sure Amazon has mandated certain safety protocols. What is your observation, so to say, about the rest of them? Like you said, if it's mandated, they'll do it, but have some of those habits been changing?
It changes when there is a supervisor nearby. It changes when there's a safety personnel nearby. But still, I see that people from, I would say particularly Indian community, but that is what I see. I can't like close my eyes towards that. So I usually see students, people from Indian community, they gather together, they don't maintain a social distance, and then they start chatting.
Mm-hmm.
So even if they're wearing masks, they're still not at a 2 meter distance.
Mm-hmm.
So this is the most common thing. So recently, like Amazon has started the safety policies, and they're very strict about it. They're even firing people. So now I see people like following it strictly.
Yeah.
But apart from that, it was like difficult for them to like go through the rules.
I think that's interesting because I've noticed that here in Toronto, and this is not just specifically to the South Asian community. I've seen people from the Black community, people from Arab community, Chinese community. It's hilarious. Like the whole personal space concept just seems to go out of the window. So people are, sometimes you have to line up, but even though there are literally circles on the floor for you to be at that distance, even the Caucasian population, to be very honest, like I have a variety of people standing behind me, and they're just on their phones, just because malls and stuff have now opened up. So if I go in, for one particular thing, I see like this whole range of youngsters who think that they're invincible and they cannot be affected by this virus. They're just blind on their phones. They're sticking to each other. And in certain times I've had to be like, can you like move back to the next circle? Or like, so I obviously look like the villain here, right? But at the same time, if I think from my own perspective, I'm a single person. My entire family is in India. I have responsibilities on my shoulders. And if I get sick today, there's literally nobody to take care of me. And as Dr. Anmol and Jayadada rightly pointed out, if I do ever get sick, nobody will be allowed to be around me. And I work with a bunch of people, so I cannot afford to be like a carrier or for this disease for other people. I have to be very cognizant about the community around me instead of being very selfish. And I think to your point, where people maybe don't think in that community perspective. And I do want to tell our followers that it's high time that we do, because it's no longer just yourself or your wife or your kids and your money in your house. I think it's important for us as a community to start thinking that, we may be affecting 10, 20, 50 other people. But I think this behavior, from what I've noticed, is pan communities. It's in every place. I think people, especially youngsters, and I'm not going to point out a particular community because it's not true. Youngsters in general have this very easygoing mentality these days. Like university students are throwing Halloween parties, they're throwing underground drinking parties and this and that, and boom, there's been, just cases galore. So I really want to encourage parents, and I want to encourage the youngsters to stop doing that, to start taking this, a lot more seriously. So thank you for sharing those insights from the Northeast Quadrant. I think that clarifies a lot of things, and we can chat a little bit more about that. Moving on to Rishiji, we'd love to hear your thoughts from a community perspective. And then I believe you have some material to share, so we'll be sharing that in a little bit as well.
Yeah, sure. Please allow me to share my screen. So
yeah.
I will run quickly from stats to some of the facts and then to some suggestions. So I won't take more time.
Perfect.
During the last 14 days, we have 590 deaths. And in Alberta, we have 18,243 active cases.
Wow.
And then in hospitals, we have 533 people with 99 in ICUs. And then yes. And then we have the geographical areas. Alberta has been divided into a few geographical areas, and I'm coming only to the Calgary area. So the local geographical areas, LGA is the local geographical area, and with the cases per 1,000, per 100,000, and then cases, and then the population. So Calgary Center, we have 453.2 cases per 100,000 population, with 300 cases with population of 66,198. So going down to Calgary East, and this is FC is Fish Creek, and then Southeast, Southwest. See the yellow part where Calgary lower northeast shows the clear picture with 568 cases every 100,000 people, 547 cases, and see the numbers above. They are all 300, and in Calgary lower northeast we have 547 with population 96,000. And then Calgary upper northeast is way ahead of everything. So this is the actually a clear picture of, and now the politicians, the reports say that the South Asian population lives in these very two parts, lower northeast and no. So these are the countries that constitute South Asia. So many countries, not only India, not only Punjab, we have so many countries. And then we have some cultural issues. We meet, greet and eat. This is
Yes.
first treat. And then our culture is multi-generational families, joint families. And then we are, we come from the lower middle income groups. So economic impact is there. And of course, we struggle for money. That's why we work and we go out and about. And then we have a culture also. We don't speak up. We try to conceal, we try to unreveal, we keep the things hushing up. So, and then we are the taxi drivers, we are the truckers, and we are the transit operators, and we are the janitorial workers, we are the cashiers at the front, we are the healthcare workers. So we have the maximum exposure. So number one is culture, number two is the work, the front line that we work on. And then there are some suggestions that we need the South Asians, if South Asians are getting contracted, if South Asians are getting infected, they need some resources. So one is PPE kits. We should be provided if the government says that South Asians are more exposed, then we need PPE kits. We need top up salaries. We need top up wages for sure. And then we need to get paid sick leaves. And then there should be some support and assistance for quarantining, for going isolation. That's what we need.
Not trying to sway the discussion in that sense, but I think pure statistics is not enough. There needs to be, you need to understand why the numbers are so high. And so Rishiji, thank you so much for giving that clarity. And even Poonam, you know, cultural aspects, the kind of jobs that we do, the kind of needs that we have, socio-cultural impact that we have within our community, the stigma, the hushing up, not talking very much, and then family members, elders, youngsters, you know, we have a ton of festivities during the year, and this whole quarantining has definitely made it difficult for us. So thank you very much for sharing that, Rishiji. I'm going to take the slide out and just would like to bring the guests back on board. So thank you very much for all your input. Thank you very much for sharing your insights. Jayji, आपने एक बहुत ही important लाइफ का आपका जो चैप्टर है वो हमारे गेस्ट के साथ शेयर किया है, which is incredibly important for our guests to understand the severity of the disease. It's not a joke, it's not a hoax, it's not कि 14 दिन का खेल है, मजे उड़ाओ ठीक हो जाएंगे. Everybody is affected differently. And like you said, your life has been altered forever. You're not the same person. You have to live differently. You have to adapt all over again. So that I feel is a big disruption. So thank you for sharing that. I'm sure it's very kind of you to make people aware of what you went through, to make them aware that this is not a joke. Dr. Kippur, thank you so much for all the medical insights that you gave us, especially about wearing proper masks and stepping out of, you know, being more serious about this, and your hand washing techniques, your safety techniques, and also to tell people that this is a long-term situation. It's not something that is going to go away in the next year. So the more vigilant and the more cognizant about this disease we are, the better. And obviously having an extended awareness that this disease just doesn't affect you, but also your inner and external community. So thank you very much for that, Dr. Kippur. Rishiji, thank you again for sharing the stats. Definitely brings a lot of clarity, because obviously there's been a lot of chatter, you know, South Asian community this, South Asian community that, but I think there needs to be some perspective in that segment. And also this is, I think ये काफी eye opener है हमारे followers के लिए to understand कि हाँ लोग बोल रहे हैं, but there might be reasons to which, and maybe it's time for us to also kind of look into our, you know, our cultural aspects and become a little bit more aware कि ठीक है, let's also practice safe distancing. Let's become a little bit more aware for our own good and for the people around us. And thank you again, Poonam, for giving us hardcore community, straight insights from being a community member yourself. I think that's hugely eye-opening for people that, don't do it just when you are being watched. I think it should become second nature. Any final thoughts from our panelists? I'll start with JG. Why don't you share some final thoughts before we sign off?
I want to underline the fact that this is not a hoax. I want to underline the facts that it doesn't matter how healthy you look. Like you may have 6 packs, you can actually hit very hard. None of you will actually boast about your 6 pack at all. I want to underline the fact that maybe you don't care, but other people do care about their family, their kids, because they've been the bread and butter for their family. So stay safe, stay healthy, and take care of yourself.
Thank you very much. And Dr. Kippur, any final thoughts?
COVID will be with us in the foreseeable future. I'll have to keep repeating the message. It's not going to go away. It's going to mutate, and already been mutating. And we will be getting frequent vaccinations and the social distancing, mask wearing, common and rapid testing is not going to go away. It's a part of our life for next few years.
Mm-hmm.
So let's pay attention and let's have patience. Let's be kind to each other, and let's not get angry against anyone. Everyone is into this together. So we'll have to support each other and hold each other's hand, and we'll be way ahead in a few years.
Thank you very much, Dr. Kippur. That's definitely a very good message. Everybody is worked up and frustrated with this, so we need to be kinder to everybody around us as well as to ourselves. Thank you very much for that. Rishiji, any final thoughts?
Just we have to be careful, as Jay and Dr. Kippur has said, that we should be wearing masks. We should be taking care of ourselves and others. And I wish everybody stay happy and healthy. Thank you.
Thank you very much. And Poonam, any final thoughts from you?
I'll say just a few lines like, this is a new normal and we have to accept it. We have to bring it in our habit.
Yeah.
And just follow it. Follow the rules. That's it. Nothing else.
Thank you very much. I think that speaks for itself. Follow the rules. Very, very important if we want to steer through and move on to a new year with a little bit more peace in our minds than we have right now. So thank you very much, everybody. This was incredibly beneficial for our followers as well as for our extended community. Really appreciate your stories, your insights, and your inputs. Hope you all have a wonderful evening, and I hope our followers will leave today with an important message. Wear a mask, take care of yourselves so that you can take care of your inner and external community. Thank you again. Have a lovely evening. We'll see you again soon.